6 signs your pancreas is crying for help and tips to heal it naturally. Are you experiencing persistent discomfort in your upper abdomen? Don't brush it off. It might just be your body sending out an early warning signal that your pancreas is in trouble. Welcome back to our channel, where today, we're delving deep into the intricate world of pancreatic health. But before we unveil the signs of a struggling pancreas, let's first try to understand what role this organ plays in our bodies. We will also discuss what happens if the pancreas shuts down completely. What causes someone to develop pancreatic disease? Lastly, we will look at foods and lifestyle changes that can help revive a struggling pancreas. So first, what is the function of pancreas in our body? The pancreas serves as a vital organ within the human body, playing integral roles in both the digestive and endocrine systems. Its multifaceted functions are essential for maintaining overall health and well-being. The pancreas is like a powerhouse for digestion and hormone regulation in your body. When it comes to digestion, it releases special chemicals called enzymes that break down the food you eat into smaller parts so your body can absorb them better. These enzymes work on proteins, fats, and carbohydrates in your small intestine. Also, the pancreas helps neutralize the acid from your stomach, which protects the inside of your small intestine from getting irritated. If the pancreas doesn't make enough of these enzymes, it can cause problems like inflammatory bowel diseases, which can make digestion painful and difficult. Apart from digestion, the pancreas also makes important hormones like insulin and glucagon. Insulin helps control the amount of sugar in your blood by helping your cells absorb it. Glucagon does the opposite. It raises your blood sugar when it's too low. Together, insulin and glucagon make sure your body keeps the right balance of sugar in your blood. This helps your body use the energy from the food you eat efficiently. These hormones also affect how your body stores and uses energy for different activities. Please like the video and subscribe to the channel if you are getting value out of this. So what happens if the pancreas dies? Digestive problems. Without the pancreas, the body would lack essential enzymes needed to break down food in the digestive system. This could lead to malabsorption of nutrients, resulting in malnutrition, weight loss, and deficiencies in essential vitamins and minerals. Diabetes. The pancreas produces insulin, a hormone necessary for regulating blood sugar levels. Without insulin, glucose cannot enter cells properly, leading to high blood sugar levels. This condition is known as diabetes. Diabetes. If the pancreas were to die, the body would not produce insulin, resulting in uncontrolled diabetes, which can lead to serious complications such as cardiovascular disease, kidney damage, nerve damage, and blindness. With this out of the way, we will try to understand what pancreatic disease is. Pancreatic diseases often start with a condition called pancreatitis. This can be either short-term, acute, or long-lasting chronic illness. And it's tricky to spot because its symptoms can seem like other health issues. When someone has acute pancreatitis, they might throw up bile, feel pain in the upper abdomen, and turn yellowish, jaundiced. These signs can be confused with stomach problems, which may cause them to delay getting help. But it's crucial to act fast because during an acute pancreatitis episode, the pancreas can get severely damaged. After the acute phase, symptoms might go away on their own, which could make people think they just had a bad case of food poisoning. But if pancreatitis isn't properly treated, it can turn into a chronic condition. In chronic pancreatitis, the pancreas gradually gets worse as healthy tissue is replaced by scar tissue, causing digestion and hormone issues, and eventually leading to diabetes. So, it's important to recognize the signs and get medical care early to prevent serious problems later on. So what causes pancreatic disease to develop in the first place? Pancreatic diseases can emerge from a multitude of factors, each potentially triggering inflammation and damage to this vital organ. Among the primary instigators are gallstones and prolonged, excessive alcohol consumption. Gallstones have the capability to obstruct the pancreatic ducts, leading to inflammation and subsequent harm. Chronic alcohol abuse, on the other hand, can induce chemical alterations within the pancreas, significantly increasing the likelihood of inflammation. Furthermore, traumatic events affecting the abdomen, such as accidents, have been identified as potential catalysts for pancreatitis. Certain medications, ranging from antibiotics to diuretics, have also been associated with the onset of pancreatic diseases, as they may provoke adverse reactions within the pancreas. Elevated levels of triglycerides in the bloodstream pose another significant risk factor, particularly when they reach exceptionally high levels. Infectious agents like the mumps virus and autoimmune disorders, where the body erroneously targets the pancreas, are additional triggers for inflammation in this organ. Moreover, genetic predispositions can play a pivotal role in the development of pancreatic diseases. Specific mutations may heighten an individual's susceptibility, rendering them more prone to experiencing inflammation and subsequent complications within the pancreas. Therefore, while the causes of pancreatic diseases can vary, they often share a common theme of triggering inflammation and disruption within this crucial organ. Early signs of pancreatic disease. Persistent abdominal pain. One of the initial indicators could be recurring pain in the upper abdomen, often on the left side, with occasional radiation to the back. This discomfort may intensify after meals, particularly those rich in fats. While it may resemble symptoms of other conditions like gastritis or ulcers, it could signify underlying pancreatic issues. Recurrent episodes of unexplained illness. Frequent bouts of unexplained sickness resembling symptoms of poisoning should raise concerns. These episodes may occur periodically without identifiable triggers, potentially signaling early pancreatic dysfunction. Greasy bowel movements. When the pancreas fails to produce sufficient digestive enzymes, fats may not be properly broken down and absorbed by the intestines. Consequently, undigested fats can pass through the digestive tract and result in greasy, oily stools. These stools may also appear bulky and may float in the toilet due to their high fat content. Jaundice. Jaundice, marked by yellowing of the skin and eyes due to elevated bilirubin levels, can indicate pancreatic disease. This is often due to the pancreatic head obstructing or compressing the bile duct, hindering bile flow, and causing bilirubin buildup. Additionally, impaired pancreatic function can indirectly affect liver function, exacerbating jaundice. Fluctuations in weight and chronic fatigue. Sudden and unexplained fluctuations in weight, accompanied by chronic fatigue, could be indicative of underlying pancreatic dysfunction. Individuals may experience both weight gain and weight loss, often accompanied by persistent tiredness as their pancreatic health deteriorates. Abdominal bloating. Chronic abdominal bloating, which persists despite dietary adjustments or lifestyle changes, may signal pancreatic involvement. This symptom, although nonspecific, should prompt medical evaluation, especially when accompanied by other potential signs of pancreatic dysfunction. While these signs are nonspecific and could be attributed to various conditions, the emergence of any of these symptoms warrants prompt medical attention. Only a healthcare professional can accurately diagnose the underlying cause and recommend appropriate treatment strategies. Now we are going to look at foods and lifestyle changes that can help restore back a dying pancreas. 1. Healthy diet. Focus on whole, nutrient-rich foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Incorporate foods rich in antioxidants, such as berries, leafy greens, nuts and seeds, which can help reduce inflammation and oxidative stress in the pancreas. Limit processed foods, refined sugars and unhealthy fats, as they can contribute to inflammation and exacerbate pancreatic damage. Monitor carbohydrate intake, as excessive consumption can strain the pancreas by requiring increased insulin production. Opt for complex carbohydrates and limit simple sugars. 2. Balanced blood sugar levels. Maintain stable blood sugar levels by eating regular meals and snacks throughout the day. Choose low glycemic index foods that have a slower impact on blood sugar levels, such as whole grains, legumes, and non-starchy vegetables. Avoid sugary beverages and desserts that can cause rapid spikes in blood sugar. 3. Hydration. Drink plenty of water throughout the day to stay hydrated and support proper pancreatic function. Dehydration can exacerbate pancreatic issues. 4. Limit alcohol consumption. Alcohol can be particularly harmful to the pancreas, leading to inflammation and damage. If you drink alcohol, do so in moderation or consider abstaining altogether. 5. Quit smoking. Smoking is a major risk factor for pancreatic diseases, including pancreatitis and pancreatic cancer. Quitting smoking can help prevent further damage to the pancreas. 6. Maintain a healthy weight. Aim to achieve and maintain a healthy weight through a combination of balanced diet and regular physical activity. Excess weight can increase the risk of pancreatic problems and exacerbate existing conditions. 7. Regular exercise. Engage in regular physical activity, such as walking, jogging, swimming, or cycling, to promote overall health and improve insulin sensitivity. Exercise can also help manage weight and reduce inflammation. 8. Stress management. Practice stress reduction techniques such as meditation, deep breathing exercises, yoga, or mindfulness to lower stress levels. Chronic stress can negatively impact pancreatic health. 9. Supplements. Consult with a healthcare professional about potentially beneficial supplements such as omega-3 fatty acids, vitamin D, vitamin E, and magnesium, which may support pancreatic health. 10. Medication, medical treatment, and monitoring. Follow any prescribed medical treatments and attend regular checkups with healthcare providers to monitor pancreatic function and address any complications promptly. It's essential to consult with a healthcare professional or a registered dietitian before making significant dietary or lifestyle changes, especially if you have a pre-existing pancreatic condition or other health concerns. They can provide personalized recommendations based on your individual needs and medical history. If you found value in this video, consider supporting us by liking the video and subscribing to the channel for more videos on how to keep our delicate organs healthy.